Good morning to all of you. Good morning to all those who make this broadcast possible, and to everyone following us every day. Today is a favorable day. We have no critical cases or deaths to report. In truth, many people said that this day would come, and I think it has. But the problem isn't that this day has arrived, but that unfortunately, we could have more cases as monitoring continues. And we know, to a certain extent, that there are still people infected with COVID-19 in the country, and that they could infect others. Bearing in mind the social distancing we maintain here, I asked to be allowed to remove my face mask so that you might understand me better. So, as I was saying, measures continue to be in place. Today is also the day that, except for Havana and Mayabeque, the rest of Cuba, that is, all the provinces and the Isle of Youth Special Municipality, enter Phase 3 of the first stage of post-COVID recovery. That's the third phase, which includes a group of conditions which our Prime Minister clearly explained on the day this decision was announced by the temporary National COVID-19 Response Working Group. But I'm certain that all of those who are working to combat this pandemic here in Cuba feel a great sense of satisfaction. Nonetheless, today, 123 people continue to be hospitalized in Cuba. 6 are under observation, the lowest number we've had over recent weeks. There are 79 suspected cases and 38 confirmed active cases. In our primary healthcare system, 135 people continue to be monitored by our professionals and specialists. Yesterday, 2,914 samples were processed, a high number despite there being few or no cases to report. So, 2,914 samples were studied in Cuba's molecular biology laboratories. 1,136 were processed at the Pedro Curie Tropical Medicine Institute, 546 in Havana's Hygiene, Epidemiology and Microbiology Center, 261 in Villa Clares, 283 in Santiago de Cubas, 354 in the Hermanos Amaheires Hospital Laboratory, 255 in the Genetic Engineering and Biotechnology Center Lab, and 79 in the Civil Defense Laboratories. As I mentioned at the beginning of the briefing, none of the samples processed yesterday tested positive for SARS-CoV-2 and COVID-19. This brings the total number of samples processed in the entire country to 229,357, of which 2,446 have tested positive for the virus, representing 1.1% of all samples studied in Cuba. The highest number of samples were processed in Havana yesterday, with 2,122. But, as I always report, samples from all the country's provinces were studied. 72 from Mayabeque, 61 from Ciego de Ávila, Camagüey 60, Las Tunas 71, Santiago de Cuba 57, and the Isle of Youth Special Municipality 56, enabling us to continue to monitor the situation in all of our provinces. Given that no new cases were reported today, I'm going to review the statistics of the pandemic in Cuba to date. Today in Cuba, 2,404 Cubans have been diagnosed with the virus. Confirmed case contacts represent 88.3% of all positive cases. This has been our main risk group. We're talking about 2,123 people. 169 people contracted the virus abroad, representing 7.3% of the total. And, sadly, as of today, it has not been possible to determine the source of infection linked to 112 cases, or 4.66% of all diagnosed cases. Out of the two sexes, more men have contracted the virus than women, but not by much, accounting for 50.45%, while females represent 49.55%. No children have been diagnosed with COVID-19 for the last 3 days, for a total of 277 cases under the age of 20. 272, or 98.2%, have been discharged from hospital, a very pleasing result, given the importance of every single person in our country, and especially children. We end this phase then with 1,339 asymptomatic cases at the time of testing, for 54.7% of the total. And of the 74 cases diagnosed in the last 15 days, 72.6%, a much higher rate than the overall total, were asymptomatic at the time of testing. Despite no new cases being reported today or yesterday in Havana, the capital continues to have the highest confirmed case per 100,000 inhabitants rate over the last 15 days, with 3.14, a rate lower than yesterday's. Mayabeque follows with a rate of 0.26, also lower than yesterday's figure. Cuba, with a rate of 0.61, is also lower than yesterday's, bearing in mind that we have gradually been seeing fewer and fewer cases. Of the 2,446 people diagnosed with the virus, 38 continue to be active hospitalized cases. As I mentioned at the beginning of the briefing, these represent 1.5% of the total, the lowest figure we have seen in the last week. 100% of these patients are clinically stable. No deaths have been reported for the last 8 days, for a total of 87 fatalities in the country. This gives Cuba a mortality rate of 3.55%, compared with the regional rate of 4.07% and the global rate of 4.21%. This means that Cuba continues to place 21st in the Americas and 110th in the world, as we mentioned yesterday. 2 patients were evacuated at the beginning of the pandemic. 11 people were discharged from hospital yesterday, a very pleasing result. 10 were discharged from hospitals in Havana, the other from Villa Clara. Today, 2,319 or 95% of people have successfully recovered from the virus. I repeat, there have been no serious cases to report in the last week and no critical cases in the last 24 days in our country. Now, the global situation, which I'm sure we have all been keeping up to date with, either through the media, television, through the press, or radio. COVID-19 continues to be present in the same 185 countries. 222,224 new cases were reported yesterday, bringing the total number of COVID-19 cases worldwide to 14,267,093. With 4,786 fatalities yesterday, the current death toll stands at 601,934, for a mortality rate of 4.21%. In the region of the Americas, which currently accounts for 53.22% of all confirmed cases worldwide, with an overall total of 7,593,083 cases, Of these, 125,679 were reported yesterday, and with 3,077 deaths in the region yesterday, the death toll in the Americas stands at 309,632, for a mortality rate of 4.07%. The top 5 worst affected countries continue to be the United States, with 3,711,464 cases and 140,119 COVID-19 related fatalities. Then Brazil, with 2,074,860 confirmed cases and 78,772 fatalities. Then India, with 1,077,618 confirmed cases and 26,816 deaths. Next is Russia, then South Africa in 5th place, and, as has been reported in the news, in South Africa and in Africa in general, the number of cases has gradually been rising. This is very dangerous, given poor healthcare infrastructure in certain places and issues that sometimes exist in reaching the entire population due to problems that may exist between different tribes and social groups. Anyway, the number of cases is rising in Africa, with South Africa placing 5th in the world and 1st on the continent. Well, thanks to all of those who tuned in today, and to all our colleagues here in the studio who will no doubt be asking me, "And now, Duran, what are you going to talk about over the coming days?" I think there are always things to mention. And I repeat, so that we all don't get depressed, that we expect to have more cases, and be assured that testing will not be reduced, but rather the restrictions will. Because we know that there are almost certainly more people in Cuba who are infected with COVID-19 but asymptomatic, and who could potentially infect others. But it's not about recognizing this fact, but rather finding these cases, isolating and treating them, in order to maintain a low or zero case rate. Many thanks to you all.